Have you ever noticed subtle changes in an elderly loved one and wondered if they could be signs of something serious? Many families miss the early warnings that an aging person may be in their final year of life. In this video, we'll explore 6 subtle but important signs that indicate their health is declining. If you want to learn more about elderly care, health tips, and motivational content for seniors, make sure to subscribe and hit the notification bell so you never miss an update. Let's dive in. Lesson 1. Drastic weight loss and decreased appetite. One of the earliest signs that an elderly person may be nearing their final year is significant weight loss and loss of appetite. As the body slows down, metabolism decreases, and their interest in food may diminish. You might notice that they prefer soft foods, eat much smaller portions, or even skip meals entirely. This happens because the body is no longer processing food efficiently, and energy demands are reduced. If you see them losing weight rapidly without any specific illness or medical condition, it could indicate their body is naturally shutting down. What can you do? Encourage light, nutrient-rich meals that are easy to digest. Offer their favorite foods to spark interest in eating. Most importantly, consult a healthcare provider to rule out any underlying medical concerns. Lesson 2. Increased fatigue and sleeping more. Another major sign is a noticeable increase in sleep. If your loved one is sleeping most of the day, taking long naps, and struggling to stay awake even during conversations, their body may be conserving energy for essential functions. This kind of fatigue is different from normal tiredness. It's persistent, unshakable, and often accompanies physical weakness. They may feel exhausted even after minimal activity, such as walking to the bathroom or eating a meal. It's important to create a comfortable rest environment for them. Let them sleep when they need to, but also encourage light movement to prevent muscle stiffness. Keep their surroundings quiet, peaceful, and free from unnecessary disturbances. Lesson 3. Withdrawal from social activities. Have you noticed your elderly loved one withdrawing from social interactions? If they used to enjoy conversations, family gatherings, or hobbies, but suddenly lose interest, it could be a sign of emotional or physical decline. This behavior isn't just about mood swings. It's often linked to a natural disconnection from the world as they approach their final stages of life. You may notice them avoiding phone calls, skipping social events, or preferring to sit in silence rather than engage in discussions. The best approach is to offer gentle companionship. Sit with them, listen to their stories, and let them set the pace of interaction. Sometimes, just being present is enough to provide comfort. Don't force socialization, but do ensure they feel supported and loved. Lesson 4. Frequent infections or declining immune function. As the body weakens, the immune system becomes less effective, leading to frequent infections. Elderly individuals nearing their final year may experience recurring colds, pneumonia, urinary tract infections, or slow-healing wounds. This happens because the body struggles to fight off bacteria and viruses as efficiently as before. Even small infections can take longer to heal and may lead to complications. Families should pay close attention to recurring fevers, persistent coughs, and non-healing sores. Proper hygiene, a clean living environment, and medical checkups can help manage infections. If you notice signs of an infection, consult a doctor immediately to prevent complications. Lesson 5. Mental confusion or cognitive decline. Another subtle but important sign is mental confusion and cognitive decline. If your loved one is forgetting names, struggling with familiar tasks, or experiencing disorientation, it could be due to a decline in brain function. This doesn't always mean dementia, but it can be an early indicator that their body is slowing down. You might notice them forgetting where they are, losing track of conversations, or even showing sudden personality changes. What can you do? Keep communication simple and patient. Remind them of daily activities gently, avoid correcting them harshly, and ensure they have familiar objects around for comfort. A supportive environment can make a big difference in their mental well-being. Lesson 6. Changes in breathing patterns. One of the most noticeable final stage signs is irregular breathing. Many elderly individuals develop what's known as Cheyne-Stokes breathing, where their breathing alternates between deep breaths and long pauses. You may also notice increased congestion, difficulty swallowing, or shallow breathing. These changes happen as the body begins to shut down and the lungs become less efficient. Families should keep the environment calm and comfortable, using a humidifier, keeping their head elevated, and offering gentle reassurance can ease breathing difficulties. If breathing changes seem severe, seek medical guidance to ensure comfort. Conclusion: recognizing these 6 subtle signs can help families provide better care and emotional support in an elderly person's final year. Weight loss, increased fatigue, withdrawal from social activities, frequent infections, cognitive decline, and breathing changes are all important indicators to watch for. If you found this video helpful, give it a like, share it with someone who might need it, and subscribe for more valuable insights on elderly care and motivation. Thank you for watching, and see you in the next video.